Greetings. This is Sisters Network Incorporated. We welcome you today for our patient and education and empowerment webinar series, Genes Matter, Know Your Family History. We are so excited to have you here joining us today. We know that it's a busy day on Saturday, so taking time to learn about genetics and breast cancer is so important. We've been bringing these patient education and empowerment webinar series all year long. They've been hugely successful and we've had wonderful participation, and we so appreciate everyone taking time again to tune in. We couldn't do these education webinars without the generous support of our sponsors, and today our generous supporters are MERCK and Tahoe Oncology, are our partners who have made today possible. So we really appreciate their continued support throughout our webinar series on various topics. Today, we're super excited to have a friend of ours, Tiffany G Carter, who has come before and shared her extensive knowledge in the area of genetics. And today, Tiffany is gonna continue the discussion and take some questions at the end of her presentation. But let me just tell you a little bit about this dynamic woman. Tiffany G Carter has been a board certified genetic counselor for more than 13 years. Having worked in a variety of specialties, she has a vast knowledge of genetics and genomics, in addition to valuable experience in the clinical, industrial, and research settings. Tiffany has a particular affinity for cancer genetics. Whether due to positive results, family history, or personal history, she counsels patients and their families with empathy to equip them with the knowledge and understanding about their genetic risk, prevention, screening, interventions, and treatment options that can greatly impact their decision-making. Tiffany received her bachelor's degree in psychology from Henderson State University in Arkansas and her master's of science degree in genetics and human genetics from the Howard University in Washington, D.C. Tiffany has presented at national conferences, supervised and trained genetic counseling students, medical residents, and fellows, written numerous abstracts, and is also a published author. She is one busy lady. She also mentors prospective students who share an interest in the field of genetic counseling. She is a member of the National Society of Genetic Counselors Nominating Committee, Texas Society of Genetic Counselors, and the Alpha Kappa Alpha Sorority Incorporated. Tiffany currently manages cancer genetics risk assessment programs in the departments of medical oncology and breast surgery at Houston Methodist, Sugarland, and Houston Methodist West Houston locations. She is a woman of faith, a wife, and a mother of two energetic and amazing little boys. I'd like to welcome Tiffany G Carter today as our speaker on genetics. We are so proud to have you here, Tiffany. Thank you again for just being a friend to Sisters Network and always heeding our call when we do call. So I'm going to turn the floor over to you because I know that our participants are really anxious to hear all the information that you have to share. The floor is yours.
Thank you so much, Caleen, and thank you so much, Mrs. Jackson, for inviting me back. Thank you so much, Sisters Network. Hello, good afternoon, all my beautiful sisters out there. Thank you so much for joining us today on this empowerment webinar. We're so excited to have you. Again, thank you for sharing your Saturday afternoon with us. You could have done anything else today, and we're so grateful that you're here with us now to learn more about genes and genetic testing and empowering and education. So thank you again, and let's get started. So genes do matter, and it's so important to know your family history. And so we're going to just empower you today. We want to fire you up. We want you to be your own advocates, and we want you to advocate for others as well. And so next slide. So the risk factors for breast cancer include, the very first risk factor is just being a woman. So as women, of course, we have breast and we have breast tissue. And so that's the number one risk. Also getting older. We know that it's a blessing to get older, but also as we get older, there are things we have to watch out for. And so the other factor is getting older and advancing in age. There's some other factors that we know increase the risk for breast cancer, like reproductive history. So if you started your menses or periods before age 12, or if you started menopause after age 55, then those are also risk factors. They increase your risk slightly. Also, having dense breast tissue. So this is when your breast tissue is tightly packed with connective tissue and there's less fatty tissue there. That's a risk factor because when you go in for mammograms, it makes it harder to see those early changes on mammogram because they just kind of fade into the background. It just all looks white on imaging. And so we want to be able to offer other kinds of imaging as well. And we know that all imaging is not equal. So it's important to ideally have the latest technology, so tomosynthesis, 3D mammograms. If breast MRI is offered to you, do that. Also, high quality ultrasounds, and all of those are operator dependent. So you want to be able to go to a place that's experienced and continue to go to that place, because if they have a record of you coming regularly, then they can notice when changes are occurring, even if they're slight changes. And so that's so important. Next, one of the other lifestyle factor risk are lifestyle factors. So those include things that you can modify yourself. So the other factors that we talked about so far, those are typically not modifiable too much. But you can modify whether you drink alcohol or whether you use tobacco, how much physical activity you get in your day. We know that the American Cancer Society recommends that all women get at least 30 minutes of exercise per day, 5 days a week, in order to stay healthy. And so we want to maintain a healthy diet as well. So eating those fresh fruits and vegetables, staying away from those sugars and high fat foods, those kinds of things. Getting in that omega fatty rich fish, those kinds of things. Also, we want to control our weight, because we know that weight gain also increases the risk for breast cancer and other types of conditions. So we want to be able to do that as well. So today we're going to focus mostly on family history of breast cancer and genetic changes that may increase your risk. Next slide, please. And so we know that every woman has a 1 in 8 chance of getting breast cancer in her lifetime. And so about 5 to 10% of breast cancer is hereditary. And those are when we can find an identifiable change on genetic testing. And so most other breast cancers are sporadic, so 70 to 75% just happened by chance or aging. We know as we age that genes don't protect us quite as well. And then about 15 to 20% are familial. So we can see that there's multiple individuals in families that have been diagnosed with breast cancer. We can do genetic testing, not find a mutation, either because of the technology is not good enough yet to pick up those mutations in those families or changes in genes, or we haven't found the right gene for that family yet. We have 20,000 genes, and we're testing for less than 100 typically when we do genetic testing. So there's still a lot we have to learn. Also, it could be environmental factors. We know that families often share similar habits, such as eating habits, exercise habits, lifestyle habits, and family members are often exposed to the same environmental things. And so maybe those are factors as well, and other stressors. Next slide. And so there was a recent study that was done that showed that individuals who are of lower income and patients of color are less likely to be referred for a genetic counseling visit. They're less likely to be referred for genetic testing, also less likely to even be asked about family history at their appointments. And so this means that you have to be your own advocate. You have to bring that to the attention of your doctors, to your providers, and that you have to let them know that you want this information and that you're willing to seek it out. Next slide. So when you're requesting and preparing for your genetic counseling visit, you want to ideally get the referral from your doctor. However, if that's not a possibility, you can self-refer. You can go to the National Society of Genetic Counselors or the Minority Genetics Professionals Network, and you can search for a genetic counselor, a clinic that specializes in cancer genetics, and self-refer. When you go for that appointment, you want to make sure that you bring the information, the family history for both sides of the family, mother and father. Both are important. You want to bring any relevant medical records, pathology reports, your treatment plan if you've been diagnosed previously. You also want to bring genetic testing records. If you've had genetic testing before in the past, we may need to update that testing. Or if there are family members that have been tested, we like to have that information as well. Also bring a list of your questions and concerns because we care about the whole person, not just the family history. We want to be able to answer any of those questions and support you coping because we know this information can be challenging. And so we want to take care of you and we want to support you. Also, when you bring your information about your family members, we want to make sure that you know the types of cancers that they were diagnosed with, the age at which they were diagnosed with ideally, and any additional information that you can gather. Next slide. So the degree of relation is important. So that means that we want to know first degree relatives, which would be your parents, your siblings, and your children. We also want to know about your aunts, uncles, nieces, nephews, grandparents, grandchildren. Those are your second degree relatives. But guess what? We also need to know about those more distant relatives, like cousins, great aunts, and great uncles. Insurance also is helpful in making sure that when you do qualify for testing, that they will go back that far to third degree relatives. So that's very helpful when trying to get coverage. Also, I want you to know that if insurance doesn't cover testing, it can still be affordable. And we can also sometimes qualify for patient assistance. And so we can get it down really low and sometimes zero. Next slide. So when we're documenting this information, we do it in a pedigree form. It looks like this. We do this pattern, we use this tool because it helps us to see information in each generation of the family and how things may be moving through or passing down the line. Next slide. And guess what? You can do your own pedigree. All you have to do is go to this website, My Family Health Portrait. It's a tool that was made by the Surgeon General, and you can put together your own pedigree. You can update it as you get new information, and keep it in a safe place. It's just for you. And so we want you to really keep this information and hold on to it and pass it down to your family members. Next slide. So what are genes and why are they important? Well, next slide. Let's talk about that. So genes are actually small segments of DNA that provide instructions for how we grow and develop. So we usually think about genes as traits: hair color, eye color, skin color, those kinds of things. But they're also important for how organs are functioning in the body, where organs are placed in the body, how we think, act, feel, and learn. And so we know that we get our genes from our parents. So half of our genes come from mom, come from dad. And that's why both sides of the family are important. Our genes come in pairs. And so if we do find a gene change that's increasing the risk in a family, then it's a 50% chance to pass it down. And that's because either the individual passes down the gene that works the way that we would expect, or they pass down the gene that doesn't work the way that we would expect. And so it's 50-50. Also, genes are located in all the cells of our bodies. So we can't change them. We can't go in and fix them for that reason. But we can modify risks. We can do prevention, that kind of thing. Next slide, please. So there was a recent study that came out this year that looked at the general population of women who had never been diagnosed with breast cancer, and women who had been diagnosed with breast cancer, looking for genetic changes in those individuals. It was a huge study. Over 60,000 women participated in it. And what they found was that 5%, or 1 in 20 of those women were found to have a genetic change that increased their risk. And those were women who had already been diagnosed with breast cancer. In the general population group, they found that 1.6% of those women had a gene change that increased their risk. And so that's 1 in 63. So this begs the question of whether we should be offering genetic testing to all women to determine their risk. And so they also found that Black women in particular in this study were typically seem to have genes, mutations in genes that were less common. So BARD1, RAD51C, RAD51D, we usually don't see a lot of these changes in the clinic. However, Black women were found to have more of these changes, and sometimes these are not on the panels that are initially offered. So you may want to look back at your genetic testing if you've had it and make sure these genes are there. If not, update your testing. In addition, they found that triple negative breast cancer was more common when these gene changes were found. And so triple negative is the type of breast cancer that does not require hormones to grow, and it's often more aggressive. And so it's important that we identify those types of breast cancer early when they're most treatable and curable. Next slide. And so, because sometimes you may not be offered genetic testing or genetic counseling referrals, you can go online and just order it yourself on the internet. It's called direct to consumer or patient initiated testing. You can do that just like you would go to ancestry.com and look for, your roots, genetic ancestry roots. However, I don't necessarily recommend that. It's always ideal to go through the clinic for these kinds of tests to make sure that you're being tested for the appropriate amount of genes. Make sure that your family history is being assessed and that you're offered all of the interventions and screenings that are that should be offered to you. But it is available. And if you do have this done, I recommend sharing those results with your doctor, and also talking with the genetic counselor if you can. Most of these labs do have genetic counselors on staff. Next slide. And so if you do test positive for a gene change, then there are some interventions we can offer. That may be through, having annual breast MRIs, which is a higher level of screening than a mammogram. You would alternate those and have imaging every 6 months. You also may qualify for prophylactic surgery or medications that can reduce your risk significantly. And ovarian cancer is on here because oftentimes we can see that breast and ovarian cancer can be linked. Next slide. So what are some contributing factors to health disparities in breast cancer in Black women? Next slide, let's talk about it. So we know that Black women overall have a 40% higher chance of dying from breast cancer than white women. We also know that young Black women, so women diagnosed at 49 or younger, have twice the chance of dying from breast cancer than young white women. We also know that Black women are more likely to be diagnosed with breast cancer at later stages and have more aggressive disease. And so because these disparities exist, it's important that you're getting your screenings on time. It's important that you're checking in with your doctors. It's important that you're doing your self-breast exams. Did you know that 40% of women who find a lump often find it themselves, either through breast self-exams or through some other mechanism that they have done on their own, not through a mammogram or through the doctor's office. So it's important to do those monthly. And they could be life-saving. It can help you detect a lump early on and go in and get it checked out. Next slide. So what can you do to lower your risk or a family member's risk? Next slide. So I was so excited to see that the Sisters Network was offering mammograms for free or financial assistance for mammograms because it's so important. So advocacy is one of those things that you can do. You can stay connected to groups like the Sisters Network and others who are making a difference in our community, and making sure that you stay supported, that you're educated. That's one of the major things that you can do. And so thank you for all of you who are on the line and on the webinar today for doing just that. And thank you so much to Sisters Network for all the wonderful work that you all do. We're so grateful. Next slide. So the other thing is, did you know that about 50% of cancers are preventable? Well, they are. And that's because of those risk factors, those lifestyle risk factors that we talked about earlier. And breast cancer is on that list of one of the cancers that can be preventable if we modify those risks. Next slide. So our takeaway points for today are document your family history for both sides of the family. Share your breast cancer diagnosis with your relatives. Please, please, please do not keep that information to yourself. Hashtag stop the silence. It's so important that you share that information with your family members. It can be life-saving and changing. We also want to make sure that you continue to educate yourself, build yourself up, build each other up, and support each other. We all need each other. We're all connected. And so it takes a village, right? And so we want to continue to support one another, educate one another, advocate for one another, all of those wonderful things. We want to ask our providers for a genetic counseling or genetic testing referral, and get your personal risk. So that was one of the things that I talked about. Genetic counselors and breast surgeons can give you a personalized risk calculation. So if you want to know what your chances are to get breast cancer, you can know your personal risk and see if you qualify for some of that extra screening. You want to be genetically tested about every 5 years if you have negative results, especially or results where there's a change found, but the lab is not sure what that means, variants of uncertain significance. Check in with about those variants of uncertain significance about once a year to see if there are any updates, because those can sometimes turn into positive results, or they can be downgraded to benign results. And that's important to know. You want to do yourself breast exams. Go to your annual mammograms on time. Follow up on the recommendations. Don't just get the information and do nothing about it. You want to get your treatment as well. I can say a whole lot more about that, but my time is up. So I'm going to speed through these last three. Eat a healthy diet, exercise regularly, modify, quit any lifestyle factors that may increase your risk, and take care of your emotional and mental well-being. It's especially important during this time of COVID and the pandemic. We need to support each other. We need to love on each other. We need to check on each other. And so do that. Thank you all so much. It's been a pleasure.
Thank you, Tiffany. Thank you so much, Tiffany, for that wonderful and informative presentation. I just want to recap for those who may have just joined us. This is Sisters Network Incorporated Patient Education and Empowerment webinar series. Today's topic is Genes Matter, Know Your Family History. We just had an amazing presentation from Tiffany G Carter, who is a genetic counselor, a certified genetic counselor, I should say, with Houston Methodist Hospital, Sugarland, and West Houston locations. And so she is a dear friend to Sisters, always heeds our call, and we do sincerely appreciate you heeding the call of Ms. Jackson, who brings her greetings. She's not with us today on this presentation, but she does bring her greetings to everyone, and thanks everyone for their attendance. Again, I would like to thank our sponsors, which are MERCK and Tahoe Oncology, who made today possible. It's just important for us to continue to bring this education and information to folks. We ask that you submit your questions in the chat, and we will be presenting those to Tiffany to answer real time, so that you can get some general information about, you know, your genetic counseling, or your questions about should you do it, when should you do it, why should you do it. I know that her presentation touched on a lot of that, but you may have specific questions. For those who might have signed on a little late, just so that you know, this presentation, all of our webinars are on Facebook Live. So hello to our Facebook Live friends who are watching right now. But we also repost this on our Sisters Network website, as well as our YouTube channel for post-viewing opportunities. So we want to make sure that you get the information now, later, or if you forgot something and you want to go back and review it, you can. So without further ado, I'm going to start taking a few questions. I think Bernadette will take some and present them to you, but I had a couple that I wanted to just get the conversation going while people are submitting. You talked a little bit about the process, but what about the security of information, particularly that website that you mentioned with the government? I know that some people may be a little apprehensive or wonder about that security side, but also on the private side, coming through like a Methodist or another private medical facility doing genetic counseling. So if you can touch on that.
Yeah, so all the information, so I'll touch on the website first. So that information is not saved to the website. You download that information. So, you know, it's not something that you have to log into to save your family history, that kind of thing. So you create the pedigree, or you create the spreadsheet, and you download that. and it's not saved on the website.
Very good.
As far as in the clinic, what we do is it is a medical record. When you come in to see a genetic counselor, we do a clinical note. So you come in for the first visit, we document that. We document the second visit when you get your results back. The results are usually not scanned or not on display typically in the medical record when you first see it. It's kind of tucked away, hidden back, and I know some institutions even lock it in their Epic or whatever their electronic medical records are. So we do know that that is a concern, and we take it seriously.
Okay, and just another quick question. Let's just be very transparent. I know there's people out there who say, I don't want to know. I don't want to know. So what do you say to those individuals who say, I know what you're saying is important. It's great information. It's important. But for real, Tiffany, I don't want to know.
Yeah, I mean, that's real. That is real. And so what I would say, if you don't want to know, then at least go in for those screenings. Definitely still take care of yourself. Go into those doctor's appointments, do those self breast exams, go in for mammograms, do that. You can even still get your risk assessment and not do genetic testing. So you can still find out if you're at higher risk based on your family history without doing testing. So if you know that information, if you know your family history information, or if you have a personal history, you've had multiple biopsies, that kind of thing that show, pathology that may be a little bit leaning more higher risk, then that's helpful as well. You don't have to get genetic testing. I would say still do your screenings because that's going to be very informative for you. Still do your self breast exams.
Okay, great. Bernadette, do you have a few questions you want to present to Tiffany?
Yes, I do. How often should you update your genetic testing?
So we know that prior to 2015, 2014, we weren't really doing panel testing. Only BRCA1 and 2 testing was pretty much being done. And so if it's been that long since you've had genetic testing, then I recommend doing update testing. Also, if you had negative results and you've done it more than 3 to 5 years ago, then I recommend having update testing as well.
Great. Does follow-up on variants of uncertain significance require another test?
It does not. Typically what we do is we do our own research to try to figure out what's going on with those variants. We can look at a database as well that gives us some information about how other labs have classified that change to see if it's leaning more benign or if it's been reclassified as more pathogenic or causing an increased risk. So you don't have to necessarily do update testing.
Okay, thank you. How many cancer genetic links show up in the females and males in a family?
So I'm not quite sure how to answer that question. What I think is being asked is if we do genetic testing, what might we find when we do that testing? So when we're doing genetic testing, we select panels, and so it depends on how many genes we look at, depending on what we might find. Like I said, some people only were tested for BRCA1 and 2. And so if you're only looking at those genes, those 2 genes, then you won't find anything else. I recommend expanded panels typically where you're looking at least 20 to 25 genes. Typically, I do a lot more than that when I order testing. And so because genetic testing can give you information not just about breast cancer, but other types of cancers that you might be at increased risk for, breast, I'm sorry, ovarian, stomach cancer, colon cancer, pancreatic cancer, prostate cancer, melanoma, and so many others. So if my patients want to know that information and know as much as they can, then I usually do a much expanded panel. But a lot of healthcare professionals are not as comfortable with genetic testing, so they may order smaller panels for that reason. Because you have to interpret, if you find something, you have to interpret it, right? And so that can be a little bit difficult if you are not as educated in genetics.
Okay. It's another question here from the chat. If you are interested in genetic testing, how do you begin and what is the cost?
So ideally you want to get a referral from either your primary care provider, either through an internist, a PCP, and GYN. They can refer you. If you are not in an area where there's a close genetic counselor, then you can, there's telemedicine, so that can be done through telemedicine as well. Or you can go online to one of those websites, National Society of Genetic Counselors or the Minority Genetics Professional Network, and look for a genetic counselor, and you can self-refer. And genetic testing the cost is actually very affordable. You can, I also want to mention that you can order the testing yourself if you go to online. You go to certain labs, they do patient-initiated testing, and you can often talk to a genetic counselor that way. We know that there's only about 5,500 genetic counselors in the country. So we know that there are not a lot of genetic counselors, and a lot of areas go underserved. And that's why telemedicine and, patient-initiated testing is there. And so you could do it that way as well. Cost can range from, I would say the lowest is around $249-ish. $249, and it can go up from there. But insurance typically covers it. We can, Medicare will also cover it sometimes. And so most labs also have where you can get patient assistance, and so they will lower the cost that way based on income and other factors. So it's very affordable now. It used to be like $3,000-$4,000 just to get it done, but because there's a lot more competition, a lot more labs available, it's quite affordable. There are also payment plans, and sometimes we can get it done for free. Depending on the lab, depending on if they're offering any research studies or sponsored testing through that lab. And if some labs also offer free testing to family members if a gene change is found that increases risk for a certain amount of time, they'll offer free testing to family members. So it's
pretty affordable.
Bernadette, let me just interject for just one
Okay.
moment. I know that the survey has been put up, and if you all could be as kind to take our survey while we're answering some of the questions, it really helps us to understand if our presentations are effective. And clearly the questions that are being answered, it appears that it is very effective, but we need your feedback. So if you'll take that time to complete the survey, it would be very helpful for us. I want to take one question out of the chat, and then Bernadette, I'll turn it back over to you.
Okay.
It says that I was diagnosed with hormone receptor positive breast cancer at age 46. I was referred to a genetic counselor by my breast cancer surgeon. However, I chose not to complete the counseling. I did have a history of breast cancer in 2 first cousins on my mother's side. Do you recommend doing genetic testing?
I do. So we typically recommend genetic testing anytime a woman is diagnosed under age 50. And that's regardless of whether she has a family history or not. And that's based on the National Cancer Comprehensive Network guidelines. So this is a group of care providers who come together and look at all the research and decide on what best standard of care, best practices are. And so it is recommended whenever an individual is diagnosed under 50 to offer genetic testing. In addition, it can go up to age 60. So if you're diagnosed with hormone negative breast cancer and you're 60 or younger, then we also recommend genetic testing for those individuals as well.
Okay.
Good question.
There's a comment as well as a question. Great information on why testing is so important. Which genetic testing should you do every 5 years?
So the reason why we talk about doing genetic testing every 5 years is because there are often new genes that are added to the panels, and the technology is improving so rapidly. So what we may not have been able to detect 5 years ago, we can detect it now. And what genes that may not have been offered 5 years ago that may increase the risk for breast cancer or other types of cancers, we want to know if there's a change there that we're missing, so that we can make recommendations about screening and prevention. And so that's why we typically recommend every 5 years. So expanding that panel basically to see if there's any new genes available and to take advantage of the updated technology.
Thank you. Question in the Q&A, should a family that has higher incidence of cancer on both sides of the family in both males and females suggest there is a cancer gene that runs in the family? For example, prostate, breast cancer, colorectal?
Yes, ma'am. Good question. So we know that both women and men can present with cancers that share the same gene and have the same gene mutation in the family. So when we're looking for familial changes, most of the time it's that same gene that's being passed down in the family that is increasing the risk for both breast, prostate, colon, pancreatic, stomach cancer, and other types of cancers. So there may be a cancer, what we call syndrome or condition, that's causing that increased risk. And so we typically would want to test we would want to test at least someone we usually want to start with someone who's been diagnosed with cancer first, because they give us the most informative information. If their genetic testing results are positive, then we know exactly what to look for in the rest of the family, if all of that cancer is occurring on the same side of the family. If it's on opposite sides of the family, then we need to test both sides for that gene change to figure out where it's coming from.
Okay, thank you. Another question and comment from the chat. I was not referred for genetic testing, and I was diagnosed with breast cancer in 2001. Now, this person is cancer-free, but was 49 years old at the time. Should I ask for a referral at this point?
I would say yes, ma'am. If you feel it's going to be helpful for you and your family to determine because you were young, we consider 49 to be young. And so it could inform us about other cancers that we might need to be screening for yourself and for your family members. And you're still young, you're under 60. So I would say I would recommend it that you consider getting a referral and having genetic testing. Yes, ma'am.
Okay, I'm going to jump in for just a second, just to say thank you for filling out the poll. We're about 67% participation. We always strive for 100% in everything that we do at Sisters Network. So if you all could give us 100% participation, we would be very, very grateful for that. So I will turn it back over to Bernadette, but we'll be wrapping up in about 15 minutes. So please do the poll. Tiffany, thank you for answering all these wonderful questions. I mean, it's real good information. I do have one quick question regarding like insurance covering genetic testing. Does that put you in a position for pre-existing, like being penalized with your insurance? I mean, that would be a concern to me.
It's a great question. And it's a valid question. And I try to address that, especially with my patients who do not have a family history or do not have a personal history of cancer. So there is something called the genetic discrimination, the Genetic Information Non-Discrimination Act, or GINA. This act keeps insurance companies from discriminating on the basis of having a genetic mutation or having a strong family history of cancer or other genetic conditions, so that they cannot raise your insurance premiums. But it does not cover life insurance or long-term care insurance, except for in Florida, I believe. They just have passed that act in Florida to cover those two as well. So they cannot raise your premiums. Typically, if you're in the military, it doesn't apply to you though. So if you're currently active in the military, it doesn't, the GINA doesn't apply. And it doesn't apply to companies that are 50 employees or smaller. And so it's a good question. And we do take that into consideration when we're offering testing.
Just a note, I see that the poll is stuck, and I thank those for bringing it to our attention. I see Nina Wilson-Jones, an old Houstonian, so she moved away, but we still love her. But thank you for letting us know about the poll being stuck. We're gonna work on that right now. Someone did have a question in the chat that's been sitting there for a minute. It says, I am BRCA1 positive. I had a double mastectomy and hysterectomy to reduce my risk. I lost my mother to breast cancer, and my sister is a breast cancer survivor. I participated with a pedigree portrait in my doctor's office. I shared my results and grateful for my sister. Should I still have another genetic test?
So it's a great question. And I would say at this point, BRCA1 and 2 carry the highest increased risk for breast cancer that we are aware of currently. So if breast, ovarian, pancreatic, those cancers, prostate cancer, melanoma, if those are the main concern, then you're probably fine. If there are other cancers in your family history other than those, and there's a strong family history of other cancers outside of breast, then perhaps.
Okay. Tiffany, what happens if you do not know much family history from one or both sides of the family?
Yes, great question. I didn't get a chance to address that in my talk, but it's true. A lot of us don't know the history on either side of the family, either because people didn't share it, our family members didn't share it, or we're adopted, or we just weren't close to those family members. Or what I often hear from my patients is that they were born later in the family. And so all of their siblings, their parents were older, so they didn't share that information with them. And so they don't really know it. I would say if genetics is an interest, if you want to know what your increased risk is, then we can still look at genetic testing. We can still do risk assessment. There are still some interventions that we can offer to try to determine what your risk might be if you're interested. but yeah, it's valid. And then we know that insurance sometimes will also still cover testing if you don't know your family history, especially if you've been adopted.
Okay, thank you. Let's see. Thanks, Dr. Tiffany. Well, I'm 69 now, and they are watching pre-cancerous cyst on my pancreas. I was the first and only one in my family to have breast cancer. Should I ask for a referral from my oncologist?
It's a great question. Um, I would consider it. That's what I would say. I would consider it because we do know that breast and pancreatic cancer can be linked. And so I would like to know a little bit more history about, how old you were when you were diagnosed with breast cancer. But I think that you should consider it. Yes, ma'am.
Okay, great. Caleen, I think I have taken all of the questions from the chat. I'll go back to the Q&A and see if there are.
I think there's maybe two, because there was one in the chat. Well, there was one in the chat that asked about male and females.
Oh, yes.
Are males also subject to this type of testing? Someone asked.
Yes. So genetic testing is for both males and females. We know that, because we get our genes from our parents, and we get half of our information from each of them, then, men can inherit these gene changes as well. And if we're talking about male breast cancer does exist. It's rare, typically. Only about 1 in 1,000 men will be diagnosed with breast cancer. But if there's a BRCA mutation or a PALB2 mutation, CHEK2 mutation, those kinds of gene changes, then it can potentially increase their risk for male breast cancer. And with BRCA2, you might remember that a couple of years ago, I think it was Beyonce's father was diagnosed with breast cancer. And he revealed that he had a BRCA2 mutation, I believe. So we do know that it can happen with BRCA2. The risk for men to get breast cancer goes up to almost 1 in 10. So it is relevant for men. And even if it's not male breast cancer, they're at increased risk for prostate cancer if there's a BRCA change mutation or one of the other genes that are associated, prostate, pancreatic, melanoma, or, we're talking about breast, but there are other genes that increase the risk for, colon cancer, stomach cancer. We all have these intestinal, digestive systems. So yes, ma'am, it can affect both men and women.
Okay. Several comments. Thanks for the great information. Let's see. Great presentation.
There's a couple of questions in the Q&A. Like, I think there's one more left in there, I believe.
No, I think I got all of those, Caleen, but I'll double check. I'll go back and double check just to be certain.
To be certain. Okay, we're about to wrap it up. There's one more question that was just submitted in the chat. And one thing, Dr. Tiffany, Tiffany, we are, Sisters Network is moving into a direction of more action. I mean, we've always worked on the awareness and outreach and educational aspects of breast cancer, but we are looking to be even more action oriented in our desire to bring about change to help, save lives and help our sisters live longer. Is there any suggestions from your standpoint in the area of your expertise that you could recommend to the organization that we could do to help with the genetic side, or that can help us to be more action oriented in the fight?
So I would say, I think genetic testing is still one of those things that there's not enough awareness about. And I think a lot of people are afraid of the cost of it. I think a lot of people are afraid that they just don't know enough information about it. Um, and so I think, ideally supporting with that, it would be nice. Just like I love that the Sisters Network is supporting those free mammograms. And providing financial support for those mammograms. I think that that's one thing that is needed for genetic testing as well. I think also just making individuals aware that genes, like you're doing, genes are important, that it's a concern and it touches everyone in the family.
Yeah.
And so I think that just bringing that side of it to it as well, and letting them know that there are interventions. You don't just learn this information and there's nothing we can necessarily offer. There are screenings and that kind of thing, and sometimes other interventions, as I mentioned, medication, surgeries that can be offered to lessen the risk as well.
Okay, I'm going to wrap it up. There's last two questions because we want to be mindful of everyone's time. One speaks to the knowing your family history. I think Cornisha Robinson's question is excellent. I was diagnosed in 2018. I was diagnosed with stage 4 breast cancer in 2021. My grandmother had breast cancer and uncle had prostate cancer. Should I have 18-year-old son tested?
It's a great question. So I would say we typically like to test individuals who have been diagnosed first. So if you've had genetic testing and there is a gene change that was found, then we offer testing to children. However, we typically don't offer genetic testing to children unless they're at least 18. And that's because most, especially related to BRCA. Now, some of the other genes that we can see cancer syndromes in, we may offer to children. But for the late onset cancer genes, we usually don't offer them to children. And that's because we want them to be able to decide if they want that information or not and how they're going to act on it. So if I would say first start with individuals who have already been diagnosed with cancer. And then if we find something, then we offer testing to other other family members.
Okay. So a couple of people have asked if we can have the recommended genetic test. If you can send Sisters Network a list of some of the recommended genetic tests, then we can send it out to the attendees today. They'd like to be able to follow up with their gynecologist or oncologist that might be unfamiliar with the test that you're recommending. Is that something that you can? Okay, so we will be sending that information out to everyone who's registered today so that you can at least have some of the general information that Tiffany Carter has suggested. And someone is asking about, is it best to have saliva or blood specimen for genetic testing? How long does it take typically to receive the results? And we'll have one more question and then we'll wrap it up. Thank you everyone who's been taking the polls. Again, you're watching Sisters Network Patient Education and Empowerment webinar series with Tiffany Carter, who is with Houston Methodist, Sugarland, and West Houston Hospital. She is a certified genetic counselor, and we are so grateful to have her here presenting on Genes Matter, Know Your Family History. Today's event has been presented by MERCK and Tahoe Oncology, who are our very important partners. And again, finish up the poll. We'll be taking it down in a moment. And Tiffany, I'll turn it over to you for these last couple of questions.
Yeah, so the question about blood or saliva, I love that question. My patients always ask me about that in the office, and I'm a true genes girl, and so I always want blood. But we know that that's not always possible. So saliva works as well. Oftentimes we can have kits. So if you do a telemedicine visit, that kind of thing, we can send kits to the home and you can spit in a tube and drop it off at a local FedEx, UPS, that kind of thing, and send it back to the lab. The only issue, the blood and saliva are comparable. The only issue with saliva is that sometimes those samples can fail because there's not enough DNA in them. So if that does happen, then we often will ask for blood if we can get it for the second sample. But most of the time, they're good.
Okay, well, thank you so much. This has been a wonderful presentation, just from the engagement with everyone. Again, Tiffany Carter, thank you for always heeding the call. We will follow up with attendees with information about some of the recommended genetic testing suggestions that Tiffany is going to share with us to share with your respective medical providers. Just a few quick housekeeping items. We do have, as Tiffany so noted, as far as our action, we need you ladies to get your mammograms. Our mammogram assistance, free mammogram assistance program is open until November 1. It's been open for a couple of months. A lot of people did not get their mammograms during COVID. If you go onto our website, sistersnetworkinc.org, you can download the application and we will get it processed. This is national, so please don't let your location be a hindrance, because we're not. And we will definitely make sure that you are getting the assistance, financial assistance, so that is not a barrier to get your mammogram and or ultrasound. We also will have some programming coming up next week, which is our breast cancer reconstruction, understanding your options. That's going to be very informative. A lot of ladies want to know, hey, I've had breast cancer, I'm having, surgery. What about the reconstruction option? Dr. Camille Cash will be with us next week to talk about that important information. And then in October, during National Breast Cancer Awareness Month, we are super excited. We'll be sending out some information, but I'm giving you guys a heads up first. We will be hosting the State of Black Breast Cancer Crisis, a national town hall discussion and call to action. This will be the first national town hall on the crisis, which we believe is currently impacting Black women and breast cancer. We're dying too young, being diagnosed too often, and we are in crisis. And so we need to save our sisters, and Sisters Network is taking the lead. We have a wonderful lineup of outstanding speakers, elected officials, medical experts, of course, community leaders with some of the top women's organizations. Of course, you see we have a lot of our wonderful partners who are part of this, as well as our strategic partners. So we look forward to sharing that information with you next week. But again, today was about Genes Matter, and we are so grateful again to Tiffany G Carter with Houston Methodist Hospital, and of course our generous friends and sponsors, because we think our sponsors as friends. They really are our friends who really believe in the mission of Sisters Network. And today it was MERCK and Tahoe Oncology. They have come through to make sure that we can provide the necessary information to you all. So again, thank you again for attending today. Tiffany, thank you. I know you have a lot to do with your family for the rest of the weekend. Everyone, thank you for taking time to be on today. And
one more thing, sorry, I just want to thank my family and my friends for being on today. Thank y'all so much for supporting me.
Oh, Tiffany's got people in the house. Okay, well, thank you. Okay. Well, thank you. Thank you, everyone. And again, Mrs. Karen Jackson, the founder and CEO of Sisters Network, brings her regrets for not being able to be on today, but wishes everyone well. And thank you to the dynamic team who does everything behind the scenes, Shadala Jackson, Bridget Holden, and Bernadette Jackson, who was doing the questions. We can't do it without this dynamic team. So thank you all. All right, everyone have a great Saturday afternoon and the remainder of your weekend. Take care.